How would I describe this past year? Unprecedented? That doesn't seem to reflect the great trial we have experienced as human beings during this pandemic, and it's most certainly not over. But thinking about my role as Imani president, I could not be more proud of the way my colleagues have served and sacrificed at this critical time. So there's this saying of the Prophet Muhammad, peace be upon him, that for every disease, God has made a cure. I think every Muslim doctor has taken some inspiration from that. I've always felt Islam was pro-science and pro-medicine.
Our parents' generation put together the Islamic Medical Association of North America 50+ years ago. It was an effort to put together a social network for immigrant healthcare professionals who were migrating to this great country to take on the opportunities that America offers all of us, research and education in the healthcare forum. And then the baton was passed to my generation. And as people of faith, it was about service. What could we do for our fellow Americans? And we've done that through the COVID pandemic. We've done that around the world and overseas, and it's about serving our fellow man, and I take great pride in that.
Seeing my colleagues going on medical missions to Haiti, Sudan, Pakistan, even here in Columbus, one of my mentors, Dr. Malika Huck, had established the Noor Free Clinic, open to everyone. I felt like I had found my people.
The pandemic was the time to step up. It wasn't just about volunteering as a doctor on the weekends or spending a couple of weeks a year on mission, although that's critical work and I'm really proud of all of that work. Now it's 24 hours a day, every day, and we just have to keep moving.
2019, Syed Ramadan, an epidemiologist, is telling America and the world we are not ready for the next pandemic.
The next pandemic is going to start, and we just don't know where or how, but we know it will.
We don't have the policies and procedures in place, and she was right.
We begin with breaking news about the coronavirus. Here in the U.S., at least 33 states and the District of Columbia have confirmed over 500 cases and more than 20 deaths.
But what can you do? You have to adapt.
We turned our entire model of care around in about a 72-hour period of time.
72 hours?
Mm-hmm. And we are about 300 employees.
Oh my gosh.
Yeah. They felt cared for. I mean, this is a group of people who, especially our people living with HIV, they lived through a pandemic before, this intense fear of abandonment by government and death and losing people in the community. So they felt like Whitman Walker does what we're supposed to do, and we took care of them. We were there for them.
And also one of the biggest things is that there's such a lack of trust of the government based on the history of brown people in America, which I completely understand. And so because of that trust, the information that was coming from the CDC wasn't being accepted. And so I felt that it was my role to step in as an African-American Muslim woman to, reiterate the important facts and information.
So then Ramadan begins, just a few weeks into lockdown, and it's like, okay, I guess that's what all this spiritual training is for. And then maybe because it's Ramadan and I'm seeing all this coverage about our community stepping up, and that motivated me to do even more.
Uzma Sayed, who led the New York State COVID task force. You have my good friend Azim Elahi, who runs an ICU down in North Carolina, and every night he would share stories about how he's sharing, empathy with his patients in their last moments by holding their hands. Saud Anwar, who helped sort of hack the shortage that we had in ventilators and found ways that we could use ventilators to help save lives.
We actually want to show you how you can actually use one ventilator to actually give breathing capacity and help to not 1, not 2, not 3, not 4, not 5, but actually 7 people. And we can go up to 8 if we need to. But
as a psychiatrist, I wasn't on the front lines of this pandemic, but I could easily see the stresses of my colleagues who were. Everyone was calling them heroes, but they often felt inadequate in the care they were providing their patients. They didn't feel like heroes. They felt like failures. I started the Physician Support Line, which has now grown over 800 volunteer psychiatrists, and we have supported over 3,000 medical students and physicians navigating the many stresses of their personal and professional lives.
American Muslims are always saying we're underrepresented, and it's true. We are underrepresented in politics and in media, but there is an area where our service is overrepresented in comparison to our numbers, and that's healthcare. We have cities where over 10% or more of the doctors are Muslim. It's not just a big city thing. My dad is an orthopedic surgeon in a small town called Beckley, West Virginia, and your country doctor there in rural America is more likely to be Dr. Chaudhry, Dr. Qureshi, or even Dr. Muhammad.
The pandemic isn't over. Can we be better as physicians, as health policy experts? Did we learn? Did we do enough to help? I'm a positive person and I have a positive outlook. But those are the questions we have to ask ourselves. That's what we'll be ultimately accountable for.